Welcome again. In this lesson, I will discuss about toddler's diarrhea, definition, etiology, differential diagnosis, and the treatment of toddler's diarrhea. Toddler's diarrhea is also known as chronic, non-specific diarrhea of childhood, and it affects children from 6 months to 5 years of age. Children with toddler's diarrhea will have 3 to 10 loose stools per day. These stools typically occur during the day when the child is awake and sometimes immediately after eating. The stool is frequently water or loose and they may have food particles in it. Stools with undigested food particles, and the stools should not contain blood. Diarrhea lasts weeks, followed by weeks of normal bowel movement. Despite the diarrhea, the child continues to grow and gain weight appropriately as long as the diet contains enough calories. Otherwise, the child is active and has normal appetite. Abdominal pain is atypical, and if it is there, it could suggest other causes such as infection. Toddler's diarrhea is not considered a disease, and the children with this condition will get better on their own by school age. So, you can diagnose toddler's diarrhea if a child is having a stool between 5 and 10 loose, watery large stools per day, food with undigested food particles, and the diarrhea lasts weeks, followed by weeks of normal bowel movement with otherwise the child gaining weight, growing, and has normal appetite and active. When we see the cause of toddler's diarrhea, there are several factors that contribute to toddler's diarrhea, including excessive fluid intake. Too much fluid can overwhelm the ability of toddler's digestive tract to absorb water and electrolytes, resulting in diarrhea. The other is carbohydrate malabsorption. Fruit juice often contain large amounts of sugars and carbohydrates, such as sorbitol and fructose, which are poorly absorbed in a child's digestive tract. The other is low fat and high fiber diet. Many children may prefer fruits and vegetables over meat or high fiber food. Fat can slow down a child's digestion, allowing more time for absorption of nutrients, preventing diarrhea. Diets high in fiber and low in fat may cause food to move through the intestine rapidly, resulting in diarrhea. The other is immature digestive tract. The nerves that carry signals to toddler's digestive tract may not be fully mature, which results in rapid movement of food through the digestive tract. This may not allow adequate time for absorption, resulting in diarrhea. There are a lot of differential diagnoses, infectious causes such as giardiasis, celiac disease, inflammatory bowel disease, malabsorption, lactose intolerance, and others. You can differentiate those things from toddler's diarrhea based on history and the physical examination. In toddler's diarrhea, the child is active, growing, and there is no abdominal pain, and the child is playful. We should have to consider other diagnoses than toddler's diarrhea if a child is having poor weight gain or weight loss, if it is continuous diarrhea without intermittent gap, and the night diarrhea, and also acid stools such as burning sensation with severe inflammation declining, bleed and the mucus in stool, failure to thrive, and associated symptoms of systemic disease like fever, rash, and arthritis. The other is the treatment of toddler's diarrhea. The first is limit fruit juice based on the age. Fruit juice is not recommended for less than 6 months, and we should have to limit the amount for older age. And we should have to avoid sweetened clear liquids. And fiber supplement can sometimes add bulk to the stool, and we should have to increase dietary fat, which can decrease diarrhea. For example, switching to whole milk by the only dietary change necessary. Avoid excessive fluid intake and grazing with bottles and the CP cups. Medications are only rarely recommended and they should only be used under a physician guidance. Thank you for watching.